This video will quickly review the award-winning study by Robinson et al., 2017, entitled, Does Dynamic Tape Change the Walking Biomechanics of Women with Greater Trochanteric Pain Syndrome? A blinded, randomized, controlled crossover trial. Lateral hip pain, commonly referred to as Greater Trochanteric Pain Syndrome, GTPS, is common and impacts work, sleep, activity, and quality of life, affecting women 4 times as often as men. While previously thought to be a bursitis, studies report that gluteal tendinopathy is the primary underlying pathology. Many studies have shown that tendons do not like the combination of tensile overload, overwork, and compressive overload. Furthermore, increasing hip adduction increases compression over the greater trochanter region and gluteal tendons. The authors of this study investigated the ability of dynamic tape to modify hip adduction moment, HAM, hip adduction angle, HAAA, pelvic obliquity, and trunk lateral flexion during gait. A change in HAA and HAM likely to result in a decrease in compressive loading due to the change in position, as well as a decrease in tensile overload due to the external force created by the tape to combat the hip adduction moment. Subjects undertook 3 walking trials using a 12-camera Vicon motion capture system. The first trial was a control, while trials 2 and 3 looked at an active taping technique versus a more passive taping technique, the order randomly assigned. The active taping was applied with the hip in abduction and external rotation, whereas the more passive technique was applied in a slight degree of external rotation only. Results showed that changes resulted in hip adduction moment, HAM, hip adduction angle, HAA, hip internal rotation, and pelvic obliquity, generally only in the active dynamic taping technique. Small changes were observed at first peak only for HAA and HAM with the more passive technique. The authors also reported a clinically significant reduction in pain with dynamic taping and suggested that this may be an alternative to corticosteroid injection and may allow exercises to be performed. This study only looked at the immediate effects of the taping application. It demonstrated the ability to change movement parameters, which are suggestive of a reduction in tensile and compressive load. The change in pain may have resulted from a reduction in load on peripherally sensitized structures. However, subjects were not classified according to pain processes, so this is difficult to determine from the present study. While it is not definitive that the changes were due to mechanical changes from the force input from the dynamic tape, the use of a more passive technique which covered the same area of skin and looked exactly the same would in large part account for factors such as expectation and skin contact. When viewing the photographs from this study, it is also evident that a greater mechanical effect could likely have been obtained by passing the tape across the posterior aspect of the hip joint and then anchoring to the anterior superior iliac spine on the contralateral side. This would likely result in an increase in hip extension, abduction, and external rotation moments being created by the tape due to the mechanical advantage and greater length changes of the tape being created. This supports the results of other studies showing similar motion changes at the hip during squat and running, and these studies will be the subject of other explainer videos.